So today I will share the prevention and the control experience, also some clinical treatment experience for the COVID patients. Firstly, today I see that now the center of the disease transfer from China to the Europe today. You can see here now the Europe today is the center of the plague, I think. So 2 months ago, I think the center stay at China, the Wuhan, and also other cities in Shanghai. Today, according to the up-to-date data, we see that almost more than 300,000 cases confirmed in the world, and 100,000 in China. So therefore, very rapidly increase of the COVID cases around the world. So I think today you will face a greater challenge in United States to the increasing cases. But so quickly, I think the experience from very early period in China maybe have some little help for you. So first one in the experience in Shanghai is a very early stage that we can provide this experience is to how to stop the virus circulation in a big city, as a very big city with almost 30 million people in Shanghai. So here I will briefly introduce the epidemic trend and Shanghai and the disease prevention and control measures in this big city, just like a city very similar like New York. The first case to Shanghai is from Wuhan city. Almost the same time, the patient enters Shanghai. I think the time I remember that it's January 2020, I think. Almost the same time, the first case emerged in United States. The time is January 21st. So the same time, so Shanghai and at the same time, the United States, we almost face the same disease. So according to our experience in Wuhan, we understand that if the outbreak of the disease emerged in our city, it will a big problem for us. I don't think we will have enough beds that we can provide to the ICU. We do not have the I don't have so many ICU beds that we can provide to the patients who need to go to the ICU. So therefore, at a very early stage, we want to control the disease at the early stage. You can see here, the first wave in Shanghai is the time that the lockdown of Wuhan, January 23. And we can see the top in our curve is it emerged at the January 29 and the January 3rd. The patients found in my city, the cases is only 30 cases in our city. After that, we can see here the wave decrease, and of course we take a lot of measures in our city to control the disease. And recently we can see here now we stay in the late stage. We can see here today we only face the challenge from the foreign imported cases, but we take a very strict measures in our city. So we can see here every day in Shanghai today we have 10 to 30 cases every day in our city. However, we control all the imported cases and no community circulations in our city. So this is what we have done in the total 2 months. We just want to control the disease in very early stage. And what we have done, so I will introduce for that. So first, we will see this is the predict from the paper published in Lancet that before the the case import to Shanghai, we can find here the epidemic trend of Shanghai, according to the prediction in the paper published by the Lancet. We can find that they predict that maybe there will be 800,000 cases will be found in Shanghai, in such a big city, and so many imported cases from Wuhan. Because before the lockdown of the city, there's almost lots of, I think at least there will be 100,000 people enter Shanghai by the airplane. So actually, we should find all the cases here and stop the community circulation in our city. So if we can do better, according to the paper in the Lancet, they predicted that there will be 80,000 patients in our city, but actually, lastly, we only have 400 cases today in Shanghai. So we can say that if we take the very strict measures in a big city, we still have the time to control the circulation of the disease in our community. So I understand that different country will take different measures to control the disease, but Shanghai, according to our experience, we do not stop everything in our city during the 2 months, but we still get some experience for controlling the disease from very high predicted curve to now we can see here very low curve in our actual cases in Shanghai. So what the measures we took in our city? So we can see here, first of all, I think the lockdown of the city, the Wuhan city, is the most important. Actually, the population traveling to or leaving Shanghai has significantly decreased by approximately 50% after the lockdown of Wuhan. And the second is a slowdown. So no import cases from Wuhan, but before the lockdown of the Wuhan, actually there's a lot of people, they entered Shanghai already. But what we took, the measure is we slow down the city, all gathering activities, and most of the recreational sites, including restaurants, theater, and etc., were closed. But the supermarket and all the chemicals still the work for the people. So therefore, during the time of the 2 months, even though the marketing, or most of the marketing, recreational marketing is closed, but the market is very needed for the usual life for the people is still open. So actually, the Shanghai is not locked down; it just slowed down. We can have our own vehicle, the transport, and to other sites of the whole Shanghai is not closed. So only the slow. So all the people in Shanghai we would be encouraged to stay at home. Shanghai, so it's very lucky that during the 2 months we have the Spring Festival holidays, and the Shanghai government, we are the first city in China. We announced that we will extend our Spring Festival holiday to 17 days from January 24th until to February 9th. After February 9th, so we will start work in our city. So everybody will go to work after months. Now today, now we know that it's almost March 25th. Actually, we started our job for almost more than 1 month. So we will minimize the possible infections for patients in their incubation period. So in the very early stage, in the incubation period, so we are very, very lucky that we stay at home during the Spring Festivals. So I think the social social distancing is very important for us to control the disease at a very early stage. But of course, today, even in the city with the outbreak, I think it is still very important. All the citizens were encouraged to stay at home unless for necessary working, shopping, and medical treatment. I think this is the first stage we have done in our city. So the second one is what you will be very interested in what we have done in the hospital, mainly in the comprehensive hospital, just like my hospital, a very big hospital with 2,000 beds. What we have done during so many imported patients, fever patients in our city, and what's the stewardship for our diagnostics for the suspected COVID patients. So this, I think, so what we have done in our hospital, I think the secret is we optimize the diagnostic flow and we do every needed diagnostic test for the suspected patients in our hospitals. I will give the experience from my hospital, Hwaseong Hospital, a hospital with 2,000 beds, as a case for you to about how to do the diagnostic test in our hospital as an experience for other hospitals in now today in United States, also in other cities. And we can see here, this is the criteria to request the SARS, the COVID virus test is in my city. In Shanghai, totally the city opened 117 designated fever clinics. These fever clinics, they will recruit the suspected cases and then send the samples to the CDC. But in some big hospitals, just like my hospital, we will do the detection firstly in our hospitals by ourselves. Now today, Shanghai, we added more 182 fever sentinel hospital. This is so this is a network in our city who I think the network can help us to find the suspected cases, and then all the patients who met one epidemiology criteria, and just if the patients from the site in Wuhan or other cities today from the foreign countries, just like the site with outbreak, just like the countries in Europe. So I think this is the epidemiological criteria. If the people today the plus the one clinical relevant symptom, just like the cough, fever, I think they can go to these clinics. We will do the diagnostic test for the patients directly. So this is a criteria what we will do the diagnostics test for the patients. Everything is free. Furthermore, the suspected COVID-19 patients would be admitted into the quarantine ward, and the CDC staff would come for sampling and do the epidemiological question. So if the Sentinel Hospital and the other, just like the hospital, like my hospital, the big hospitals, we have in the big hospitals, we will have the quarantine ward in our fever clinic or our in ID department. So if the patient is suspected of COVID, the CDC staff, the region, in our different region in Shanghai, they have their unique CDC staff. They will come to the hospitals, come for sampling and do the epidemiological question. I think the CDC staff in the United States, maybe not, you do not have so many staff in your countries, but in Shanghai, in every region in Shanghai, we have lots of city staff can help us for sampling and do the epidemiological tracking and do the confirmed diagnostic test for our patients. If the nucleic acid test turned out positive, all patients were enrolled into the designated hospitals in Shanghai. In Shanghai, we have designated hospitals who will care for all the PCR positive patients. So today, I stay in the designated hospitals to lead my expert panel to see all the patients. The designated hospitals in Shanghai, so this is a public health medical center, and actually we have the capacity to have the beds, more than 1,000 beds that we can contain all the confirmed cases of COVID. So this is what we have done in Shanghai, the stewardship of the diagnosis and the quarantine and the treatment for the patients here. For the diagnostic, I will say more about the co-infection in the COVID patients. In the first stage, I noticed that in United States, some hospitals, they will do the flu and some other virus diagnostic test firstly. If the patient is positive for flu or other virus, just like adenovirus and the other pathogens, they will do no more COVID testing for the patients. But according to our trial in Huashan Hospital with 2,000 beds, the big hospitals, actually we screened all the suspected cases. We found almost there are lots of co-infection in our people. I will see here some data. So this is a co-infections. So just like we published a paper in the Emerging Microbes and Infection to present our 20 cases with COVID. We can find here 11 cases here, they have the only COVID infection, but the 9 cases, they have the co-infection, including the influenza B, influenza A, and the rhinovirus, enterovirus, and also the common virus related with the fever here. So I think in the time with the COVID outbreak, I do not think is no detection for the patients with a fever for COVID can be accepted in Shanghai. We noticed that there's lots of co-infection here. So another concern is about the high false negative rate in the PCR. So in all the confirmed cases, we found the first time the PCR, the positive rate is almost 70%. But the second time the PCR, it will be increase the negative cases more 50%. But if the patient is highly suspected in my hospitals, so even the 2 times of the PCR is negative, I will do the natural generation sequencing for the patient. So if we do further natural generation sequencing for the patient, all the cases can be found. Of course, there will be a very high cost if we do so many detection for the people. Therefore, I just recommend that. So in the outbreak, the season, so the COVID, the PCR, the false positive, negative, the false negative rate, so maybe between 10% to 30%. Even sometimes we will do the double check for the patients. So because the diagnostic test sometimes not so sensitive, so sometimes we will think if we just take the CT scan as our clinical diagnosis for the patient, but actually we found even the COVID, the CT scan, the phenomena is very typical, but sometimes actually we cannot discriminate the other disease from the COVID. So the upline, we can see here, all the CT scan are from the confirmed confirmed COVID patients. But we can see the down line, we can find it here. So there are some other pathogen caused the pneumonia. We can see here there are some cases from the RSV, the virus, viral pneumonia, mycoplasma caused the pneumonia, and or para-influenza virus cause pneumonia. All the cases are confirmed by our next generation sequencing and the multiplex PCR to confirm the cases other than the COVID. Therefore, the CT scan, I think, is not enough for us to confirm the case. We still need the molecular diagnosis for the patient. So in my hospitals, if we have suspected the COVID, we will collect those virus specimens to the PCR for the other pathogens together with the first time the COVID, the PCR, the virus PCR. If the positive for COVID, we will send the patient to the quarantine site of the designated hospitals. If the first time COVID PCR detection is negative, we will send the sample for the second time the PCR. So second time it's still negative, and of course the positive will confirm the case. But if it's still negative, if clinically we highly suspect of the critical cases, we will do furthermore the next generation sequencing, multiple plastic PCR, and also send the sample to the national certified third-party agency to give the positive or negative diagnosis for the patient. If everything is negative, we will rule out the patient and transfer the patient to the common ICU ward or the common respiratory department. So this is what we have done in our city. We can see here. So more and more patients. This we can see left side is the days from the suspected contact to symptoms onset. So this is, I think, maybe the incubation days for the patient. Left side is the graph we can see here. Majorly the median data is 6 days. The right side is the days from symptoms onset to hospitalizations. We can see here in Shanghai. So if the first time the patient have symptoms, almost after I think 4 to 5 days, the patient will be diagnosed and sent to the quarantine. So the experience here in Shanghai, the timely diagnosis and the timely diagnosis and the timely quarantine is very important for us to stop the circulation of the case in community. So I think the time is the most important here to find the case, give the timely quarantine. I think here is the major the experience in here to stop the circulation of the cases in our community. So up to now, we only have 400 cases in Shanghai and 60 cases from all the 400 cases are from the foreign country now. So today, everything changed. Our major job we will do to stop the cases in the custom and also in the community to control the imported cases. So this is all the cases here. We can see here from the very early stage to now. We can find here this is a very high curve during the January 30 and January 29. This is the peak of all the cases. So there's 2 colors in all the cases we can find here. The green one is the cases emerged in the community without the traveling history to Wuhan or other big city. So the red one is imported cases. So in Shanghai, according to our previously experience, we found that our experience is to control the circulation of the cases in the community. So here, therefore, we found that all the cases, I can see here the green ones. I mean, the cases from the community is not so many cases here. So I found if we have a lot of community circulation, I think we cannot control the disease very well. So I think here the diagnostics and the find the cases timely is very, very important. So this graph is from Italy. Italy here, we know that in very early stage, all the cases are from other countries. But today we found that the early control of the local transmission has not been done very well. So therefore, the disease spread. Now we can see here that all the cases are from the community in Italy. So I think today the strategy for control the cases in Italy, I think it should be changed and not take the very early strategy just like that in Shanghai. So in the meantime, I will talk about some treatment options for the COVID. I stay at the designated hospital every day. Just the major job currently for me within the 2 months, I just do the treatment for the patients to save the people there. So today I know that in our city we have 400 cases and 4 of them dead. So only I think the 1% of the very ill patients now is now dead, but almost 95% of the patient now they actually say recovered and left our hospital already. So I will give some treatment option, so experience for you for what we have done in our hospitals, designated hospitals. First of all, I will introduce the antiviral treatment. Today, there's a lot of recommendation of the antivirals, and this, of course, there's a lot of debate from all the antiviral treatment. The recommendation is controversial from different countries, from different papers, and also different doctors. According to my experience and our published papers, today I will say that currently no effective antiviral treatment has been identified. So almost every drug we used in our hospitals for the patients, including the Abidol tablets, including the lopinavir, ritonavir combination therapy. Of course, Shanghai is almost the first city in the world to use hydroxychloroquine in our patients. And in China also have some experience for the remdesivir, but today I know that the United States, you have more experience for using the remdesivir for the patients. So we do all the clinical trial in China using such drugs. But in the meantime, I just what I want to say is that the efficacy today in the world, every drug, even there's a lot of paper published that say this drug is good or not good. But according to my experience, not so significantly efficacy in these patients we can see from this antiviral treatment. In the very early stage, we published a paper to say that the lopinavir and ritonavir not so effective. Actually, we know that from the paper published in the New England Journal of Medicine by the Dr. Ding Cao from Beijing. They published a paper in New England Journal of Medicine, also agree with us previously published Chinese journal about the efficacy of lopinavir and ritonavir, the treatment. Today, is very controversial is about the efficacy of the hydroxychloroquine sulfate. According to my experience, maybe there's some efficacy of this drug, but not so significantly. The efficacy from the other controlled the cohort. So still in China, I think China there's multiple center study for the hydroxychloroquine and compared with other antiviral treatment, but not remdesivir. I think the paper will be published soon about this multiple center study for give the very good evaluation of the hydroxychloroquine for this drug in Shanghai. Today, I cannot recommend anyone for you to do the preventive or the treatment. But of course, all these drugs, I do not see any very severe side effects from my patients. So I think the compassionate drug could be used under permitted situations, including the hydroxychloroquine and included the remdesivir in Shanghai and also in the world. So furthermore is about what is the most fundamental treatment. I think I want to say it is the oxygen. So here is a paper published by my colleague who went to Wuhan from Zhongzhang Hospital, Wenhong Zhang. They published a paper in the JAMA. They say that in all the 144 of the total 201 patients were discharged from the hospital already, but still they have 84 patients delivered ARDS. So 53 were admitted to the intensive care unit. So 53 they were admitted to the intensive care unit ICU. And received the mechanical ventilation, and 44 died. So in Wuhan, my colleague in Wuhan, they found that the mortality in the critical care patients is very, very high. So almost 22 or 23% of the patient died. So I read the paper and I found that in all the patients with ARDS and in Wuhan, only 6%. So only 6%, only 6%.
6 patients.
Only
6 patients.
It's 6 patients, and one is also the mechanical ventilation with the ECMO. So I think a rate is not enough. So I think very high mortality is related with the medical source limitation. So this is a major, I think, is a major reason that cause very high mortality in the Wuhan and also in Italy today. So we can compare the data from Wuhan and Shanghai. All 17 ARDS patients in early stage, we will give the invasive mechanical ventilation, and 6 of them were treated with ECMO. So today, in all the patients in Shanghai, in 70 ARDS, critically ill patients, only 4 patients, and 4 patients died, and 6 ARDS patients were discharged. So in all the critical care in Shanghai, the mortality is 23, but we found that in all the 77 patients from Wuhan, 44 patients died. So I think we can compare among all the invasive mechanical ventilation support rate, 7% in Wuhan and 100% in Shanghai, and the mortality rate today in the critically ill patients, 52% mortality and 23% mortality in Shanghai in the critical ill patients. So I think the medical resource for the ICU is very, very important if we have lots of patients in our city. Furthermore, I think if there's some indicate that will let us know very early stages progress of the patient, I think the indication, the D-dimer and the LDH is very important. Furthermore, of course, we found maybe that the anticoagulation treatment for the patient in very early stage is also it will help us to reduce microthrombus burst in the patients. So we can see here this is a fruit. This is the fruit from a patient with the lots of the microthrombus. But this phenomenon not so frequent in Shanghai. In all the 400 patients in Shanghai, only one patient they emerged as this phenomenon. So I think the anticoagulation at a very early stage, according to the value of the D-dimer, and is very important. The other side is very controversial is for using the corticosteroids. Today, I know that according to the guideline from WHO and also guideline from the United States respiratory doctors experience that the corticosteroid is not encouraged. However, so in China, I think we still have a very narrow window that can help us to stop the progression of the patients, to stop the progression. The patients stay at the severe stage, but not progress to the critical ill stage. The critical ill patients, I think we need to give the patients the mechanical ventilation support. But if we give the patient a very narrow window, with just like if the CT scan progress very quickly, but the LDH is not so high, I think we can just give the patients very low and short duration corticosteroid. Sometimes it can help to decrease the progression rate from the critical, from the severe case to critical care, critical ill case. So maybe we still need a more prospective study to find that if we use corticosteroid in some small part of the patient with severe phenomenon. Okay, this is the potential effective treatment from Shanghai. So the other treatment, I think the life support critical air is also very crucial. Just a right time frame to nasal cannula or oxygen inhalation, high flow nasal cannula oxygen therapy, invasive mechanical ventilation, and the ECMO should be determined for the patients. In Shanghai, I think in all the patients, 20% of the patients, they need just a bed. We give any kind of the oxygen therapy. But 5% of all patients, I think, maybe they need the very high level oxygen therapy, maybe the invasive mechanical ventilation or ECMO for the patient. So organ support, hemodynamic stability, nutritional support, the analgesia and the sedation should be maintained according to the situation in the individual patients with critical ills. So I think just one by one, just individually for treating the patient. I think I do not see any very big difference from the other viral pneumonia in our COVID patients. Now about the prognosis for the patient. So overall mortality now in the world now is COVID-19 is around 3 to 4%, and near or less 1% in Shanghai. The main risk groups are elderly. In Shanghai, actually, the elderly part of the patient is the highest in China. All the patients died in my cohort. Most of them just very high elderly, high age, and almost more than 75 years older. So the patient, another one is about the previously underlying disease. The young people also has a relatively low chance or progressing to severe disease state should be aware of the fact that they could easily transmit the disease to others. This just recommend for you that if the patient, the young patient, have the underlying disease, just the heart disease, hypertension, and or the DM, I think they still have the risk to progress. Sometimes the time from the mild to severe is very quickly. The median time from the mild to the severe is 8 days, but sometimes just 3 days will progress to the very severe status. Now, the last the recommendation for you is about how to protect the medical personnel. Actually, in China, we protect the medical personnel very good. Up to now, all my medical personnel sent to Wuhan and all my medical personnel in Shanghai, we have no medical personnel infected by the COVID. So therefore, we will do the qualified and standardized process. That means including doctor-patient access is different. Medical personnel access is actually we have do this very strictly. Secondly, appropriate personnel protective equipment is very important, including the masks, isolation gowns, goggles or visors, double layer gloves, double layer shoes covers in our ward. But I don't think if we do not have so many PPE, we will still have some very important PPE for our medical personnel. Then the comprehensive mask or positive pressure sometimes we still need. In Shanghai, we have the positive pressure breathing mask for our personnel. But sometimes in Wuhan, we do not have so many positive pressure breathing masks. I think this the positive pressure breathing mask only for the doctors who will do the examination or will do some specific the medical treatment for the patient. I think may be needed if the aerosol is very easy to spread in a very short distance in very narrow space. So then the disinfection and the isolation is very important. Negative pressure ward in Shanghai, but no negative pressure ward in Wuhan. I think negative pressure ward may be just according to the condition every hospital. The other is use hydrogen peroxide to disinfect the environment and at least every 4 hours to wipe the surface of objective. The use of hydrogen peroxide to disinfect the environment at the end. So this is what we have done in Shanghai. So thank you very much for your time. And I think I spent too many time, and now the time of Q&A not so many. So now I will transfer my time to the coordinator, Dr. Wang Kaiyue. Yeah.
Okay. So next session is Q&A session. In order to maximize the using time and help the doctors and the healthcare workers, we pre-collected some questions from Stanford Healthcare, Santa Clara County Hospitals, New York Hospitals, and the CABC members. So we will start with those questions. If we have enough time, we will get to the questions submitted by the audience. If you have additional questions and suggestions, please email them to us at info.cabsweb.org after the webinar. Okay, so let's start the first question.
Okay.
Okay.
Okay, thank you, Kaiyue. And now I will continue my part for the Q&A for you. And
Professor Zhang, would you mind to share your screen?
Yes.
Okay,
yeah,
great.
Share the questions.
Just 1 minute, just several seconds. Yeah. 把我片子拿出来，这个也可以，这个也 OK 的，这个可以的，可以，这个都可以。Can you see the screen?
Yes.
Yes, we see.
Oh, can you see? Okay. I'm here I will together with my colleague to answer all the questions for you. And some questions were answered by my colleague. She do the job for for what you asked. Okay, so firstly, I will answer a question about what's the time window between infection and test positive, and then I think I will ask my colleague to answer this question. Can you answer this question, Dr. I?
Yeah.
So I just want the time window between infection and the test positive. You do every the test for the patients in our hospital. Okay,
Okay.
you answer this question. Okay.
Hello everyone, I'm a colleague also at Huashan Hospital. So concerning this question, what is the time window between infection and test positive? From our side, we believe that if a patient acquired infection, the time it took for the PCR test to turn positive would be a really quite a close range of time, possibly under 2 or 3 days it would test positive. However, there is the other test, the serological test. We have the IgM antibody and IgG antibody for the serological test. The positive result would sometimes turn positive, I think, in about 8 to 10 days after the onset of diseases. So actually for PCR, the test would turn positive pretty quickly. However, what we have learned is that, especially for newly published data in the Lancet Infectious Diseases, I believe, all the scientists have found that actually it's the viral load was actually the highest during the first week of the disease onset. So basically for these diseases, the test positive rate could be much higher at the early onset diseases than the latest. So for general public, what are the criteria to request a SARS-CoV-2 PCR test for healthcare workers? So here's what we do in Shanghai. In Shanghai, the test requirement was made by the physicians and doctors, and all the patients should meet with 2 criteria, which is at least 1 epidemiological criteria and 1 clinical criteria. So for epidemiological criteria, the patient has to return from a region or a country that has previously reported with a local transmitted diseases. So right now, actually in Shanghai, this criteria has been very widened. Previously, at the very early start of the epidemic, we usually only test people from Wuhan or Hubei province or patients who are in contact with the confirmed cases. But right now, the epidemiological criteria will require patients coming from basically around the world, because all the world has a reported local transmitted outbreak in their countries. And also, if the patient has been in contact with laboratory confirmed patient, or if the patient during their household there are 2 or 3 close contacts who has all required the same symptoms. So if under such 3 conditions, if the patient met with at least one of them, he would met with the epidemiological criteria. Apart from that, if the patient also has any kind of clinical symptoms such as fever, cough, or even diarrhea, the patient would met, and then the patient would get a PCR test. So basically, I think in China, our testing was very strong and actually pretty widened. And we try to test all kinds of suspected patients. And I think that is the key for Shanghai to keep a very close monitoring of the whole epidemic trend. And the third question, I believe, is what are the pros and cons of PCR-based tests versus antibody tests, false positive and false negative rates? From our test, we have not done a lot of antibody-based tests. We have done all PCR-based tests of all suspected patients, but antibody tests have been performed only in 50 or 60 patients. So from our point of view, basically PCR are the golden diagnostic standard. That is like there's no other method that can beat the PCR-based test. However, we should understand the potential of antibody tests. The potential of antibody test to me is more like a complementary test, alternative beside PCR test. If the patient, the antibody test will usually turn positive in the later disease period, usually 8 to 10 days after the disease onset. So during that time, I think if the patient has a low viral load, and if the PCR test, because we all know the PCR test has some false negative rate, So during that point, if the PCR test in the later disease process become negative, maybe this is when the antibody-based test could provide some useful tool in diagnosis. Also, the antibody test may play a more vital role in the overall epidemiological test. If we want to know the overall infection rate during the population, that may be the reuse of antibody test, in my opinion. Thank you.
Okay. Doctor, I think you give a very detailed explanation for the diagnostics. You also see that the young generation doctors in China, the English is very good, much better than me. So I will answer the second question is about so how to prevent the viral RNA degradation during sample processing. And I think this is another it's a laboratory question. I think my colleague will answer the question. She did the laboratory job in my ward. Okay, answer the question. RNA degradation. Do you think that the RNA degradation will happen in our sample processing?
Usually we just try to process the sample as soon as possible as we got it. So basically we try to process the sample 4 to 6 hours after we collect it, and if not, we should put it at least in the I think in the refrigerator. I think it's minus 20 degrees or minus 80 degrees. That would be okay to prevent degradation.
Okay, now for the people who are self-quarantining for 1 day at home, should they be tested? If yes, when and how frequent? Actually, if the suspected case have the self-quarantine for 1 day and no symptoms, we do not think he or she is a suspected case. Actually, I would think we will do not do any not do any detection for the people. What is risk of infection for pregnant women and infant compared with our demographic group? In fact, what are the treatment options? Actually, not so many pregnant and children infected in Chinese people. However, but now we found that lots of sometimes there are some children cases. But today, I will say that all the children cases are very mild and no antiviral treatment in Shanghai. I think everything is very good. The prognosis is very good. No severe cases, no dead cases in Shanghai. Now, up to now, we still have the 30 to 50 cases already in Shanghai, and I think the children and the pregnant today and no dead case and no severe cases everything is good. So then I will wait. I will answer the quickly for this question about from mild to severe symptoms. How long will it take? Actually, I answered this question in my presentation. I think 80.5 days is mild to severe symptoms. Why people with underlying medical condition are at high risk? Young age, but with underlying conditions are also at high risk. That's right. It's especially for the patient with heart disease, I think is majorly the highest height. Sometimes I found that the virus have some effect on the heart. So at a large population level, do you observe the attenuation of the infectivity or pathogenicity of SARS-CoV-2 of time? I don't think so. Now you will find that not so many severe people, the rate of the severe case is not so high at the very early stage because we find lots of patients with asymptomatic cases we found. So the rate of the severe case is a decrease. But actually, I do not think there's a related with attenuation of the infectivity on pathogenicity. So ibuprofen and acetaminophen, actually, we do not use so many NSAID. But I will recommend the acetaminophen, which is so usually used in all the cases and no side effects for that. Literature reports the ERB inhibitor. I do not see any efficacy of the ERB inhibitor. So I do not see observe people taking ERB can show higher chance for the COVID infection. So I think no effect of the ARB inhibitor to the patients in China. COVID treatment. What is the percentage of the recovered patients showing detectable neutralizing antibody? Every case recovered, we will see the antibody. But is the antibody work or not? Actually, I cannot answer this question. There's a different kind of the antibody. Of course, I believe in the acute infection, one of the antibody can work, can have the efficacy against the COVID. Will upcoming summer slow down global pandemic of COVID? Sure. The upcoming summer, of course, the pandemic of COVID will slow down because the United States take action right now. I think if the United States take action, everything will, the pandemic will be slowed down. But I do not think it will eliminate it in this year. Maybe in the winter, we will another small curve of the disease. I don't know. I cannot predict for that. But of course, the summer, upcoming summer, everything will slow down. However, I think that in the coming 2 or 3 months, it's very, very important for us to take action to stop the spread of the disease. So everything we have done in Shanghai is very strict for the patients. Of course, every country have their own condition. I think just take the very important measures to do their job. So hydroxychloroquine for prevention and the treatment, I agree with you that there's some data support to use hydroxychloroquine, but also there's some other controversial data, so do not support. But if we do the prophylaxis treatment for the medical personnel or the house contact, I think maybe it's okay because we do not see any side effects for all the cases we treated in Shanghai. So this is about hydroxy the treatment. Now how to use the dosage? Actually, in Shanghai, we use the first day we will take 400 milligram BID the first day. In the second day and continuously, we will use 400 once daily for the patient. We will not use azithromycin together with hydroxychloroquine because we're concerned about the hepatic injury, the liver injury for the combination therapy. So therefore, in China, we just take the monotherapy for the patients. The protection healthcare works, of course, this is very, very important. Of course, the most important is to cover the head, I think. So how often the healthcare infected from the virus? So in China, up to now, only in Wuhan, in very early stage, they do not take any PPE, think there's a very high rate of the healthcare work infected. But today in Shanghai, and all the medical personnel sent to Wuhan from my ward, I do not see any doctor infected or any nurse infected with the virus. If regular surgical mask is sufficient for healthcare, I think it's not enough. I think not enough. In all our fever clinic, we will ask my colleague to take the N95. Are you routinely testing healthcare workers who are exposed to COVID patients? In China, some hospital will do that. In my hospital, I will do that. But actually, in most of the hospital will not do that. So I think if no symptoms, if we take very good PPE, I think maybe it's not necessary. So the last one is also about the PPE. What is the minimum workflow to preserve PPE while still protect work? I think the mask, the mouth mask is very important. So this is the basic to protect. And can COVID be transmitted by air droplet? I do not see the droplet in my hospital, but we found that if we do not take any protector equipment, I think the droplet, the airborne, I think is still at risk. But I do not see any patients who get the infection in the elevator or in the hospital fever clinic. They just take the infection in very intimate the context. Just in house context is a major part. At the US, healthcare workers go home after work. What procedure needed to be done to prevent spreading the virus to family members? Yes, this is a good question. My colleagues in Shanghai Children's Hospital, they just do what you have done in the United States. All the health workers go home after work. But in my hospital today, in Shanghai Public Health Center, in the designated hospital, we will stay at the hospital. So actually this morning, I asked my colleague in Shanghai Children's Hospitals, all the healthcare workers, they go home after work. So today they have care for almost 30 to 40 cases of children patients. So they go home every day. They just take very good PPE and have a bath and have some cleaning for the nose, mouth every day. And after that, we will go home with his family members. And during they staying at home, they will not have the dinner with his family members together. They just have the dinner separately. Remember that, separately with his or her family members. So this is their experience. Do not have the dinner together. So the health works in Shanghai. So protection of healthcare workers, this is about the PPE. More is better. For healthcare workers, they interact with COVID patients. What needed to be done before eating and drinking? I think the PPE, if you do the PPE good, I think it will be of no problem. If no enough PPE, I think dangerous and the risk is still there. Of course, more cleaning is better. The cleaning including the face and also the nose. Discharge and follow-up. I think the patient will do the PCR 2 times negative, they will discharge. Discharge and 2 weeks self-quarantine at home. That's enough. All my patients in Shanghai, the rebound rate is not so high. So I think 14 days enough. If a patient survived severe COVID, will he or her son suffer long-term injury, fibrosis? This time, not the same, just like in 2003, the SARS. This time, all severe COVID-19 patients discharged and they will recover everything after 2 weeks. And some patients now still, they come to my hospital to thanks me, giving me a thanks letter. I can see he or she can have the very good recovery of the disease. Therefore, I think even the patients have some fibrosis, but not so severe, not the same with the SARS. So therefore, this is all the experience from Shanghai experience. Now almost 4 minutes and more than the planned time. So I will give the time for Dr. Tian. I'm done for today's sharing. Okay.
Hey, Professor Zhang, thank you so much. I know you're very busy. You might have to leave, so feel free to leave at any time. And thank you so much for your time, and also thanks so much for the co-worker. I forget her name for also answer some of the questions. Thank you so much.
Okay, thank you.
Thank you very much.
Thank you. I wish everything will be good in United States. I hope that I will visit the United States soon after the outbreak, after the break. Okay. Hope everything will be well. Okay. I will thank my doctor, the beautiful lady, Dr. Ai Jingwen. She has no experience working in the United States, but her English is much better than me. I'm glad to see that. Thank you very much. Thank you. See you. Bye-bye. Yeah.
Thank you.
Thank you.
Thank you. Bye-bye, Professor. Thank you so much.
Bye-bye. Bye-bye.
Bye-bye.
Bye-bye. Bye-bye to all the audience today in the website. Okay. Thank you.
Okay, great. So for all the audience and you're still online, and thank you so much for enjoying today's experience. Lastly, I just want to say, let's all work together to fight this disease. Follow Professor Zhang's advice, use them and apply them, and follow US CDC local government suggestions and make your own best judgment, and then to see what's the best, what's the right way to do, what we should do, what we shouldn't do. And also, by the end of the day, thanks everybody for attending CABS events, and we'll have a few more exciting events lining up later. Please keep a close watch our email, our website, and I want to see you in our next event.
Thank you. We're gonna close our
Yeah. Right.
webinar.
I think yes, we can close. So